Hi guys, so I'm going to be teaching you how to use a standard walker. So from a seated position, the first thing you're going to do is grab the walker and set it up in front of you so the open side is facing you. And then this chair doesn't have armrests, but normally you would reach up from your armrests or you can reach up from here and stand up. And then you're going to move the walker a little bit in front of you and step forward with the injured or affected leg first, and then come through with the other foot. And then repeat, and then come through. Step, and come through. And then for sitting back down, you want to make sure that you reach back with your arm to grab the chair, and then make sure that your legs, the backs of your legs touch the chair before you actually make the move to sit down. And then you're going to fold the walker back up, and then you're done. So one of the major things that you want to be keen on is making sure that you're on the proper surface for using this walker. Is much different from using a rolling walker because this one you actually have to pick up instead of just moving along. Okay, so first what you're going to do is grab the walker and put it in front of you and open it up so that way the outside is facing you. And then either using the armrest from your chair or grabbing the handles on the walker, you can lean forward and stand. Next, you're going to move the walker a little bit in front of you and then step forward with the injured or affected leg first, and then come through with opposite leg. And then you're going to repeat, so move, affected leg first, and come to. And then to sit, you're going to reach back and feel for the chair. And then sit down, making sure that the back of your legs are touching the chair before you sit down. So some of the precautions that you want to take when using a standard walker are you want to make sure that it locks when you open it up. So you should hear it click. You can move it a little bit just to make sure that it clicks, just to make sure that it doesn't fall on you. And then when standing up and when walking, you want to make sure that your hands are on the grab bars at all times. And then another precaution that you want to make sure is keeping it at your proper height. So the handle should be level with your hips and your elbows should be slightly bent. And if it is not the proper height for you, you can always change it using these little adjusters at the bottom here to make it shorter or taller depending on the height of the person.
Okay, so I'm going to be showing you how to use a sock aid. These are useful for precautions after a total hip or total knee replacement. So you can start by having the sock aid in the sock next to you, or you could have them if they're on the floor, you can use a reacher to prevent the flexion of the hips, which is a precaution for total hip replacements. So what you're going to do to start is you're going to take the sock aid, and the open part is going to face towards you, and you can kind of squeeze it between your legs to hold it steady. And then you're going to take the sock, and it's going to be a lot easier if it's bunched up, and the part with the heel is going to go along the back closed side, and the toe or the top of the sock is going to face towards you. And you're going to want to make sure that the toe's pulled all the way tight so that you don't get bunching in the toe. And then once it's on the sock aid, you can small adjustments to make sure it's like straight, the heel's not crooked, and you can pull it up really as far as you can onto the socket to prevent as much bunching as you can. And then you're going to hold these with 2 hands, kind of put this on the floor in front of you, move it to your foot, then you're going to slide your foot in, and then you're going to pull the socket out. And then if you want to adjust it more, you can use a reacher and make any adjustments you want. Okay, so you're going to pick up the sock and the socket, and then you're going to have the open part facing you, and you can support it, in between your legs. And then you're going to take the sock, and you're kind of going to roll it up like with your fingers, And then the top of the sock is going to be facing you, so the heel is going to be going on the flat closed part. And then make sure that the toe is all the way pulled down so you don't get a lot of bunching, and the heel is centered on the back. And pull it up as far as you can and pull it down to prevent the bunching. On the ground. And then using the reacher, you can make adjustments. There you go.